Dear students, welcome back. Now we are going to see the sternoclavicular motions. So the motions that occur at the sternoclavicular joint are 3 degree of motion, and this 3 degree of freedom of motion are explained as elevation and depression. Another one is the protraction and the retraction of the clavicle, and also rotation of the clavicle, These are the movements or the motions that are occurring at the sternoclavicular joints. Motions of any lever are always described osteokinematically by the movement of the distal segment of the lever, So for example, if you take arm or an upper limb, so you are moving at the shoulder joint also. What is happening? The other segment below the joint is moving. That is the segment which is present distal to the axis, that part will move. So based upon that, the movements are described osteokinematically. But here, this clavicle is the only bone in the body which is arranged horizontally. So in this case, if you want to explain the motions of this lever osteokinematically, we have to refer this lateral part of the clavicle. We have to refer the motions of the lateral part of the clavicle. Okay, so the horizontal alignment of the clavicle can sometimes create some confusion and an impairment visually of the clavicular motion. So that means during elevation and depression and protraction and retraction should be visualized as the lateral end of the clavicle is moving or not. Okay, so during that time, sometimes during protraction and retraction, you may mistaken as elevation and depression. During elevation and depression, you may appreciate that movement as protraction and retraction. So a careful observation has to be done whether it is clavicular elevation or depression or protraction and retraction. In the case of clavicular rotation, here the rolling of the entire clavicle occurs. So at this motion, that is the clavicular rotation, you will not have any visualization problem. That normally occurs in other movements. Okay, and this clavicular anterior posterior rotations or long axis rolling motions of the entire clavicle. That is the clavicular anterior and posterior rotations or long axis rolling motion of the entire clavicle. Whereas in the case of 3 degrees of translatory motion at the sternoclavicular joint can occur, but they are having very small magnitude. The translation of the medial clavicle on the manubrium are usually defined as anterior and posterior, that means anterior and posterior. This one is anterior and posterior. Medial translation and lateral translation. Another one is the superior translation and inferior translation. So these are the three types of translations of the medial clavicle occurs on the manubrium. Okay, so now we are going to see in detail about this clavicular motions. The first one is the elevation and depression. Elevation and depression of the clavicle. The motions of elevation and depression occur between the convex clavicular surface and a concave surface formed by the manubrium and the first costal cartilage around an AP axis, that is the antero-posterior axis. Okay, and this antero-posterior axis, so if the movement is taking place in the AP axis, that means at the sagittal axis, the movement is taking place in the coronal plane. The sternoclavicular axis is considered to lie lateral to the joint at the costoclavicular ligament. So this axis is present lateral to the joint at the costoclavicular ligament. This AP axis of which helps in elevation and depression. So the shape of the surfaces and the location of the surfaces and the location of the axis. The shape of the surfaces and the location of the axis indicate orthokinematically, that means inside the joint what is happening. So orthokinematically, that the convex surface of the clavicle must slide inferiorly, so must slide on the concave manubrium and the first costal cartilage. It may be inferiorly or it may be superiorly, that we will see. Okay, so based on the shape of the surfaces and also the location of the joint axis indicate orthokinematically that the convex surface of the clavicle must slide on the concave manubrium and the first costal cartilage in a direction opposite to the movement of the lateral end of the clavicle. For example, it is moving upwards, the medial end will slide inferiorly, or when this lateral end is moving downwards and this one slides upwards. So now what is happening in the case of elevation of the clavicle and depression of the clavicle? So during the elevation of the clavicle results in elevation, this one, so from here to here the clavicle is moving. During elevation of the clavicle, there is a downward sliding of the medial clavicular surface on the manubrium and the first costal cartilage. So the location of the axis is so far from the joint increases the intra-articular surface, increases the intra-articular motion, we can call it as intra-articular motion. Normally the clavicular range of elevation is about 45 degrees, whereas the depression is about 15 degrees. And this elevation and depression of the clavicle is associated with the elevation and depression of the scapula, because the lateral end of the clavicle is attached to the scapula. Okay, so when you see with the scapula, the elevation of the scapula that is associated with clavicular elevation is not a pure motion. Okay, but it is associated with concomitant upward rotation. Concomitant upward rotation of the scapula. Okay, here what is happening to the clavicle during elevation. So as we know that the lateral end of the clavicle is moving upwards, there is an downward sliding of the medial side of the clavicle on the manubrium and the first costal cartilage. So what is happening here? That means with the elevation, the lateral clavicle rotates upwards. The lateral clavicle rotates here at the lateral side. Rotation of the clavicle towards upwards is occurring. With the depression, the clavicle rotates downwards. With the depression, the clavicle rotates downwards. Okay, so that is the thing happening during elevation and depression on the lateral aspects as well as the medial aspect. Okay, normally the full range of motion of elevation along with the trunk motions is above 180 degrees. So though it is having such a degree of movement, but such 180 degrees of range are not used during functional ranges, during some functions, because functional ranges of arm elevation is about 45 degrees of elevation is enough for doing our normal functions. So though it is having 180 degrees, that is maximum magnitude of arm elevation, but we are not using such kind of degree of elevation during normal functions. Okay, this is about the elevation and depression of the clavicle. Now coming to the protraction and retraction of the clavicle. So protraction and retraction of the clavicle. Here you can see the superior view. This is the clavicle, manubrium, and this one is the scapula. This is thorax. Okay. Now here you can see the movements of the clavicle during protraction and retraction. So the protraction and retraction of the clavicle occur around a vertical axis. So you people know that if it is a vertical axis, the movement is taking place on the transverse plane, isn't it? Yes. The protraction and retraction of the clavicle occur around a vertical axis, which is also lies at the costoclavicular ligament. And given this saddle shape of the joint, in this movement the configuration of the surfaces are reversed. So, in the case of elevation and depression, what is happening? The convex surface of the clavicle articulates with the concave surface of the manubrium as well as the first costal cartilage, isn't it? So, because of this saddle shaped, because of the saddle shaped of the joint, so what is happening here? As we know that the medial end of the clavicle on the vertical view it is convex, but as AP view it is convex, isn't it? Concave. So that concave structure is articulating with the convex side of the manubrium. Convex side of the manubrium helps in protraction and retraction. Okay, so protraction and retraction occurs around a vertical axis which is also lies at the costoclavicular ligament. Because of the saddle shape of the joint, the configuration of the surfaces has reversed in this movements. In this plane, the medial end of the clavicle in this plane, that means in the transverse plane, medial end of the clavicle is concave, like this, concave, whereas the manubrial side of the joint is convex. Manubrial side of the joint is convex. Okay. So that change on the manubrium is maybe due to the articular disc which is present on the side of the manubrium. Okay. So here the movements, that is arthrokinematically, the clavicular surface will now slide on the manubrium and the first costal cartilage in the same direction as the lateral end of the clavicle is moving. During protraction, what is happening? So there is an anterior translation at the medial end along with the anterior motion of the lateral end of the clavicle. Okay, and during retraction there is an posterior sliding of the medial clavicle on the manubrium, and also there is a posterior movement of the clavicle during retraction. Okay, the range of motion averages about 15 degrees of protraction and 15 degrees of retraction. Okay, and also a greater retraction is also available, that is up to 30 degrees is also available, that is called greater retraction is also available in the sternoclavicular motions of protraction and retraction. Okay. So during protraction and retraction of the clavicle also, there is some sort of movements taking place at the scapula level. So during protraction, there is an movement on the scapula occurs, that is the abduction of the scapula occurs during protraction. Whereas in the retraction of the clavicle, there is an adduction of the scapula occurs. Okay. Because the scapula is attached to the distal end of the clavicle. if you can see here, so for example, so this is the part distal end of the clavicle which is attached to the scapula. During protraction, what is happening? The clavicle is moving anteriorly. What is happening? So because of this attachment, the scapula pulled is pulled towards anterior. That means it is moving sideways. That means it is abducting. So the scapula is abducting because it is moving away from its medial plane. So it is called as scapular abduction during protraction. Whereas in the case of retraction, again it will comes to its normal position. So that is called scapular adduction during retraction of the clavicle. So these are the sternoclavicular motions, and another motion, that is the rotation of the clavicle, we will see in the next video. Thank you.